first started talking about the suffering model, I have to say I actually pushed back and said, suffering is an icky word. I don't really like it. As a nurse, it makes me feel like I need to do more for my patient. And I then became a patient. In 2013, I was diagnosed with breast cancer. And I realized that suffering is the right word. It's totally the right word. And from there, as a nurse, again, it's not enough to say that patients suffer, and it's not enough to measure suffering. You got to do something about it. And so the Compassionate Connected Care framework came from that experience. It says that what we're talking about is not patient satisfaction. It's not fluffy stuff. It's the clinical, the operational, the cultural and behavioral aspects of the care we provide every day in every setting by every person, connecting clinical excellence with outcomes, and connecting quality with efficiency, and connecting engagement with action, and the mission, vision, and values of an organization with engagement of the people who work there. And the affinity diagram that came from hundreds of images that clinicians and non-clinicians and patients provided demonstrated that we have to acknowledge that our patients are suffering and show them that we understand, that anxiety is suffering, that the real caring transcends the medical diagnosis. It's not enough just to take care of me. You have to connect with me as a person. And the story that I like to tell, when I was in the hospital, my first day post-op, the nursing assistant came in and she was really, really busy. Her hair was on fire, and she said, we have to go to the bathroom. And I said, okay, we'll go to the bathroom. And so we're slowly walking to the bathroom, and I said, wow, you guys are really busy. How many patients do you have? And she said, well, I have 11. And I said, well, how many does your nurse have? And she said, well, she has 6. And I said, well, that's a lot. And she said, no, it's not so much that we have a lot of patients, it's just that everybody's so needy tonight. Now, that was in a top 100 hospital. So if it happens there, it happens everywhere. And now I'm thinking, is she talking about me? Because the last thing any nurse in the hospital wants to be thought of is needy. And I've tried really hard not to press my call light. And by the way, it was your idea to go to the bathroom, not mine. And that's what I was thinking. And I had just had major surgery. I had a lot more stuff to come, and I shouldn't have to worry about whether or not the staff thinks I'm needy. But that's what I was worried about. And as we walked into the bathroom, I looked down at the toilet seat, and there was blood on the toilet seat, and it wasn't mine. And again, top 100 hospital. And now, it's not just that the bathroom is dirty. Now the entire organization, in my eyes, is dirty. And so I'm at risk now for infection, which means that they have failed in their one important task, which is to keep me safe. And so out of that really was born the Compassionate Connected Care model. When I go in and I talk to our client organizations, I don't talk about the score. None of them went to school to be at the 90th percentile. They went to school to take care of people. And the score comes as a natural consequence when you do the right thing for the patients and the people who take care of them. If the focus is only on achieving the 90th percentile, you'll never get there. The focus has to be on achieving the optimal patient and caregiver experience. And that has to be the focus. And I think the Compassionate Connected Care model really resonates with people who take care of patients because it's not about a score. It's about understanding that these are people who happen to be patients at the moment, and that there is no light between clinical quality, patient experience, and safety. It's all the same thing. When I was talking with a group of Mayo CNOs a few weeks ago, when I finished the presentation, much like I just did, they said, we never connected patient satisfaction with safety. And I said, that's because it's not about patient satisfaction. It's about the totality of the patient experience, which is clinical, operational, cultural, and behavioral.